The government's former chief scientific advisor, Sir Patrick Vallance, is giving evidence at the COVID inquiry today. During this morning's session, Sir Patrick criticised the government's response to dealing with the spread of the virus.
There was a lot done in terms of what needed to be, what the options were to reduce the spread. So quite early in February, work started on non-pharmaceutical interventions. Neil Ferguson in particular drew up a lot of modelling around that, what the different options were, and came up with a figure that others endorsed as well of needing to get a 75% reduction in contacts in order to try and really suppress this to the right level. So there was a lot of work done on the modelling. There was a lot of work done exposing those options into COBRA, including with the behavioural science input on that. And there was a discussion, which I think Boris Johnson puts in his statement, which he had with the CMO at the end of February on lockdown options and what the implications of those would be. So I think there was a lot of evidence that there were things that needed to happen in order to achieve this aim of suppressing the curve. I'm not convinced that there was a very effective operational response to that.
Well, health correspondent Ashish Joshi joins me now. And Ashish, also this morning, an admission for him that perhaps decisions weren't made at the right time, mainly, you know, from what he is saying, because they were really surprised at how quickly COVID spread.
Yes, that's right. The former chief scientific advisor, Sir Patrick Vallance, not being fiercely critical at this juncture. We're only an hour into his testimony, not really saying that they should have done this and they shouldn't have done that, but making it very clear that all the evidence that was being presented to the scientific community in this country in February, as we were heading into March, was that the virus was spreading much quicker than had been previously feared, and that urgent interventions were needed, the NPIs, the non-pharmaceutical interventions, not straight into a lockdown or a national lockdown, but certainly the social distancing and the tiered arrangements that we later saw introduced. He said he was pushing for this quite early on because it was apparent that the R number, the reproduction number of this virus, was becoming quite alarming. It was spreading very quickly, and that some interventions were going to have to be introduced very quickly. There was resistance to that. He mentioned the Chancellor, and he said obviously the Chancellor had his own interest in protecting the economy. There were discussions around tensions between him and the Chief Medical Officer, Sir Chris Whitty, whether Sir Chris Whitty wanted to introduce those NPIs early on, and he said possibly not. Sir Chris Whitty was worried about the long-term effects of long-term lockdowns. So we're beginning to see what was happening there, but certainly Sir Patrick Vallance explaining that he wanted to go much harder, much sooner, and this was being pushed back by the people around him in government.